welcome to the show today, Healthy Living. I'm Kaylene Cornell, Health Education Coordinator for the Purchase District Health Department. HIV diagnosis is no longer the death sentence that it once was. 30 years ago, doctors had little more than just comforting words to offer patients who had been diagnosed with the virus. There still is no cure for HIV or AIDS. However, remarkable advancements in treatments, along with better understanding of how the disease progresses, are allowing doctors to help their patients live longer and more fuller lives. Today I'm talking with Andrew Halford, Interim Executive Director of Heartland Cares Incorporated, about HIV and the importance of testing, along with some testing events that we're going to be talking about. Well, welcome, Andrew. Thank you for being here today.
Well, thanks for having me, Kaylene.
This is a topic that is just so important. First of all, I would like you to just kind of start talking about where Heartland Cares is located and a little bit of the history of the clinic.
Okay. We're located at 1619 North 30th Street. We've been there for a good number of years now. We started in 1996 with a very basic kind of grant, and by 1999 we had a full service HIV/AIDS clinic. Wow. Dr. Anita Fleener Ford was very instrumental in the startup of Heartland Cares and is still one of our infectious disease doctors 14 years later. So we're very pleased with her involvement and with her success in this community. Dr. Carl LeBoon, now a partner of hers in the infectious disease doctor's practice, also works with us. So we have two of the finest infectious disease doctors in Kentucky, if not in the Southeast. So we're very pleased to have both of them working with us. Mm-hmm. We are a full service medical clinic. Of course, all of our patients, and we have now right at 410 patients that we see in a year's time.
Really?
And we increase that exponentially every year. We're full service. You have to be an HIV/AIDS patient to have access to our clinic, so that's the number one thing. Mm-hmm. But we are, for many of them, a primary care clinic, so they come to us for anything, whether it be a cold, flu, high blood pressure, diabetes, and we are a referral clinic too. So our doctors, if there's something that they need to have done that our doctors can't do, if they need to see a specialist, we're able to refer them on. We also have mental health services at Heartland Cares. We have a full-time mental health specialist who works with our clients and also does referral if they need substance abuse, if they need additional psychiatric counseling. She will refer them to that specialist. We have basically a full-time dietitian. She works with us 35 hours a week. She is very proactive with all of our clients, going into the exam room and talking with them about their eating habits, how that affects their health, the interaction with the drugs that they might be on.
Yeah.
You did mention something that I think is very important for people to understand, and that is that there is not a cure for HIV/AIDS now. But we do have a regimen of drugs that are absolutely astonishing in the fact that a person different from 30 years ago can live a full life. Yes, they'll be on these drugs the rest of their lives, but they will be able to live a full, normal, productive life. So that's really the important thing. If they get in and they're diagnosed and they follow the regimen, they're adherent, they're going to be fine. It's not the death sentence that it once was.
Yeah. Now, when do they start the medication right away when they're diagnosed, or is this something that they would start later? When does the medication come into play for treatment?
Well, of course, the very first thing we have to do is the testing. And there are two types of tests that we do. We do the oral quick, which is the first test. It takes about 20 minutes. It's confidential, it's painless, it's fast. We have counseling during that 20 minutes, and that's really for the test to set up. So the staff member will sit and talk with the person about, HIV/AIDS, how you get it, what you need to understand about the whole regimen, and taking care of yourself. If it is positive, then we go to the Western blot. We have to take them either to LabCorp, or when LabCorp is at our clinic, they can draw the blood. So that is a blood test, as you know. And then once that is looked at, if that confirms the positive from the OraQuick, then we get them in immediately to see a doctor. And then from that point on, they're under the doctor's care.
Okay. All right. What, when a person is told they have HIV, how does that impact their life right from the beginning?
Well, it depends on the person. One of the things that I think is really important for us when we're doing counseling is to ask the person if he or she has, what kind of support group they have. What about their family? Then after, if it's positive, then after that we ask them deeper questions about that. The doctors go into that. The mental health specialist will go into that, because the important thing is that this person's not going to find him or herself out there alone. That they have a support group that cares for them. They have a support group that's going to nurture them, that will treat them with respect. That's what's so very important. We don't want anybody to feel as if they are alone. So that's one of the big things that we do, is to look at the emotional and the psychological impact that this drug has on individuals, because there still is a stigma. We are the best kept secret in Paducah, and for some of our clients, that's the way they want it to be. We have to be very anonymous in how we deal with our clients. But the important thing is that people know that you have to be adherent. That this is not a death sentence. This is not something to be ashamed about. This is something that is it's not curable, but you can maintain a healthy lifestyle, and that's the important thing.
Absolutely. And it sounds like, right away, the education, in all aspects, from, mental health, but, to the nutrition aspect, because how does the nutrition impact with HIV?
Well, I think one of the things that our nutritionist tries to point out to them is you have to have a healthy lifestyle. You've got to look at what you do. You've got to look at how you spend your money. It's another thing that we work with our patients on, with our clients on. But in terms of the nutrition, and we all need to understand this. I need to understand this, that what I put into my body, the food I put into my body, interacts with everything else in my body. Any other kind of medications that I take, for me, that would be high blood pressure. That's important for me to understand that. So we have 2 events every week that we call the SPINS groups, and that's where the dietitian, the nutritionist comes in, along with the mental health specialist. She prepares a meal. There's a lunch. It's usually pretty light, and then there's an evening meal. And what she does is she prepares healthy foods, foods that they like, but maybe they don't prepare them in the way that she does. And she shares the recipes with them. She talks about the ingredients. She talks again about the interaction of particular foods, and that's really important. She customizes her conversation, the nutritionist does, to each person's medications. The other thing we have at Heartland Cares, we have a full-service pharmacy. We've just now celebrated our first anniversary. We've had the pharmacy now for a year. It's a wonderful connection for us, because the nutritionist has access to the drug interactions. The doctors have access. So it's really important. The pharmacy folks can work with the clients, work with the patients on adherence, making sure that they have their medications, they're up to date on their prescriptions. So that has really helped us. We do mail orders, we do deliveries, any way that's going to be helpful for our patients.
Wow.
So that's a good thing.
Absolutely, and
Yeah.
that because you do have that, it sounds like at your facility a chance for them to just be private and yet get information from pharmaceutical to all the areas. So
And we help them with housing. We have one of the best housing programs in the state. There are 6 agencies in the state of Kentucky. There are only 2 of us that are what we would call full service standalone. The other 4 are associated either with a university, medical center, or with a health department. But Paducah, Heartland Cares in Paducah, and Matthew 25 in Henderson are the standalone. So we are the 2 full service clinics in Kentucky. So that means that, again, we're doing the medical, we do housing, so we can help you with your utilities, we can help you with your rent, of course, if you qualify, and then we also have what we call the social services, the medical case managers, which are the real navigators for most of our clients in terms of their medical, their adherence, their social services. So we can work with them on living essentials, food, gas, whatever they need, and provide them an avenue for support, which is really important. So,
absolutely, yeah.
They're true
Because
navigators.
with this disease comes along sick days, and I'm sure impacts the job.
Sure it does.
So
sure it does. Sure it does.
that's you wouldn't even think of when you first started talking about housing. I'm thinking, well, that's that's nice, and then I think there is a reason for that.
Exactly. So I mean, truly, we look at the impact of everything that happens in a person's life on their healthy living. That's what we are about. Our new mission statement, just let me share this with you and those that are listening. Our new mission statement that the board has adopted is Heartland Cares, Heartland Cares embraces those affected by HIV/AIDS with open arms through care, prevention, and community awareness. You mentioned a few minutes ago about the immediate process of education. One of the things that we're most interested in has to do with outreach, prevention, and education, because we see prevention and education being a very important part of outreach. And of course, the other part of outreach is the community awareness. The community, and we just finished our second in May, the 1st of May, we had our second Spring Teenie. It's a big fundraiser. It's down on 2nd Street. Last 2 years we've worked with the city and we've closed off the market area on 2nd Street. This year we had 7 restaurants participate with us. They provided signature martinis and hors d'oeuvres for people to come and to sample the martinis and to have a good evening and to learn something about Heartland Cares, because we really do want the community to be aware of who we are, what services that we provide, what a wonderful mission, what an important mission we have. I probably shouldn't have used the word wonderful, but what an important mission that we have in this community. That's really important for us.
Absolutely.
Yeah.
And with the education and prevention, that's going to slow the spread of the disease.
Right.
And
that's,
you talk to your people about that?
Oh yeah, yes, we do. Let me share some statistics with you that I think are really, really important. These statistics come from 2009, so as I said to you earlier before we went on the air, I don't know how the numbers would have changed significantly in the last 14 years, but we're looking at the 6 high schools in the Paducah and McCracken County area. At that time, in 2009, there were 3,035 students enrolled. And this is a behavior survey that these students are asked. We found out that out of the 3,035, that 1,388 students had been sexually active. So that's a significant number.
Yeah.
When asked how many people that they had been sexually active with, 186 said that they had been sexually active with more than 4 people in their lives.
Right.
When you look at those numbers, when you look at those statistics, that's really significant in terms of the impact. When asked how many of you did not use a condom in your last sexual intercourse, 41% said that they did not use a condom. One of the things that I've learned in the almost year that I've been the interim director at Heartland Cares is that the younger generation, from 15 to 26, the young people, 15 to 26, don't always really understand the impact of the sexual relationships that they have, the impact on their lives and the impact on the lives of the people that they've been intimate with. And one of the reasons is that they've grown up in the last 20 years, 14 really, seeing the improvement in the medications. So many of them think it's like diabetes. It's treatable. And they also think I'm invincible. This is not going to happen to me.
Yeah.
One of the biggest impacts that I've seen is when we have a youth event, and they're amazed. These young people who come in, they're just amazed at what we tell them, and we give them these statistics. How many of them are actually in this 1,388? We don't know. But it's just amazing to hear them talk when they leave about everything that we've presented to them. So one of the things that we really want to encourage is this testing. If you are sexually active, you need to be tested. You need to be tested at least once a year. Our motto is that it is free, fast, painless, and confidential. You come in, you're tested. Anybody can walk into our clinic from 8 to 5, Monday through Thursday, and be tested. And again, the results are available within 20 minutes. They have counseling within that 20 minutes. They're asked some questions in that 20 minutes. And that's important that they understand that. And then we do anything from that point on as immediately as we can. So we think that's key, because we want them to understand that if you're positive, that doesn't mean a negative in terms of your life, in terms of your future.
Right.
It doesn't, which
Now,
is important.
When you mention of with the testing or with your hours, do you have after hours if there's like urgent care type, or is there an on-call?
There is an on-call. Our doctors are available 7 days a week, 24 hours a day.
Okay.
So
someone who's been tested and has gotten the diagnosis, that they're if there's questions or if there's concerns.
Exactly. They can call, and we'll get back with them as quickly as we can. Yes. And that's one of the things that we're very concerned about. If someone were to come into our clinic who was tested someplace else, one of the first things we'll ask them is, what kind of counseling did you receive? And it's just amazing the number of people who are tested someplace else who don't get the adequate counseling. So many of them come in and they're very nervous. They feel like their lives have been totally turned upside down.
Yeah.
So it's very important that we, when we do the testing, provide them with the counseling that they need. We get them in to see a doctor as quickly as we possibly can, get them started on their drug regimen, begin providing services for them that they need. One of the great things, since this is not a death sentence, you can have a normal life in terms of work. You can have a normal life in terms of your relationships. And that's really important for people to know, you know, that you can go on. You do have a reason to live. That's really very important.
Right.
One of the things that you and I have been working on, I think, has to do with some testing that we're going to be doing.
Absolutely.
Next week.
Yes, very, very important. The date is June 20th.
Right.
And why don't you tell a little bit what the main focus for this?
Well, Kaylene, I just really do appreciate you and Jennifer Doom contacting Heartland Cares and asking us if we would work with you and the Purchase Area District Health Department to put this event on, because I think it's really important for us to establish partnerships.
Absolutely.
You
Yeah.
know, not only with the health departments, but also with other medical providers in the community. I mean, we work well with both of the hospitals. But anyway, we sat down and we talked about what we could do next week, and we came up with the 20th because we're going to be providing the testers. You're providing the test kits. You're providing a great lunch, some great snacks for people. We're going to do this, as I recall, from 11 to 2 at the W.C. Young Community Center, which we think
which is just down the street from the health department, not far.
Exactly, exactly. And we think that's a good neighborhood. That's one of the things that we want to emphasize at Heartland Cares. Is, again, this community awareness, and that it does involve neighbors. So we're going to be open, and we hope that people will come in. Again, we say, remember, testing is free, fast, painless, and confidential. So we're going to have four testing rooms set up that day. And we think we're going to have staff there for those 3 hours. And we're excited about doing this. I think this is a good partnership. You are also giving away some little bags too, aren't you?
We are. Yep, we have some giveaways, and we have an amazing door prize.
Great.
It's a really nice bike.
Good deal.
With just all the accessories you would need, from the helmet to the cable to everything that you would want for your bike. So, we want people to be a little excited to come, and enjoy the food.
Right.
And we also are going to be giving a small bag with a lot of good information in. And I know some things, that pamphlets are just boring, and who cares about those? But they're informative.
Sure they
because
are.
with
Sure they are.
HIV, you also are dealing with other diseases along with that.
Right.
So.
And one of the important things, and we were looking at some of those brochures when y'all were at the clinic not long ago, the face of HIV/AIDS, there is no face. There is no face. You can't look at anybody and just automatically know. And I'm talking about age, I'm talking about race, I'm talking about gender. You don't know. The diversity is just incredible. We were at a conference last week, and the demographics. If everybody in Kentucky could see the demographics of Kentuckians infected with HIV/AIDS, it's just the diversity is just it's mind-boggling. So there is no face.
Right.
There is no face, which is a good thing in a way.
That's right. You cannot just say, well, this type of person will probably get it.
Exactly. You can't. So then, National Testing Day, we're going to be open on June the 27th, which is the next Thursday. We're going to be open all day that day, and we are emphasizing coming in to Heartland Cares at 619 North 30th Street and be tested from 8 to 5. If you can't come to the W.C. Young Center on the 20th from 11 to 2, you can come to Heartland Cares on June the 27th, the very next Thursday, anytime, 8 to 5, and you can be tested. Once again, it's free, it's fast, it's painless, and it's confidential. And if you are positive, that does not end in a negative future for you. So that's really very important for people to understand. And
one of the things that I think is important too is you'd mentioned to be tested every year. So a test doesn't mean that you're good. I've been tested once, and so I know something.
Yes, it depends on how sexually active you are. You don't have to be tested every 6 months unless you want to be tested every 6 months. We say that once a year is adequate, particularly if you're sexually active. You need to be proactive. Everybody needs to be proactive in their sexuality. You know, so that's one of the important things. You need to be proactive. You need to know what you need to do to maintain a healthy lifestyle, and to enjoy life. You know, that's important. So I would encourage people to come out.
What would
either
you
on the
say
20th.
one thing about HIV and prevention? What is one thing that you would recommend people to know and educate themselves on?
Well, I think the most important thing for people to understand is that they have to be safe. They have to be safe. And they have to have conversations with people. They can't ignore what they do and its impact on other people. That's really very important. You have to think about how your practices impact the other people in your life. And you've got to be aware. That I think that's the bottom line. That's the bottom line.
Yeah.
Yeah. But I do encourage people to come out either on the 20th or the 27th. And again, I'm really pleased with our partnership.
Absolutely. Yeah, we can only do so much as one entity, but as we join with others, we can just, you know, spread the awareness and prevention so much further. And
Exactly.
and you're great partners to work with. So
Good
we're looking forward
Good
to
deal.
it.
Yes, yes.
Well, thank you so much for coming today, and I know there's been a lot of information that people have learned from what you've brought up. So thank you very much.
And thank you for having me, Kaylene.
Sure. Yeah. Well, thank you for watching the show today. And like Andrew mentioned, remember the 2 HIV-free testing dates, June 20th at the W.C. Young Community Center. That's just down the street from the Health Department. And then June 27th is National HIV Testing Day. And it's so important for everyone to be aware of that HIV is in your neighborhood and it's in our community. And to educate yourself and to be tested. Also remember, there's testing at the Health Department and at Heartland Cares at any time. So you just don't need to wait for those certain days for testing. It can be any time that you can go in and to be tested.